Two people can use Wegovy or Zepbound for 1 year and lose completely different amounts. One may lose 20% of body weight, while another loses only 5%. Willpower is rarely the main reason. Dose consistency, appetite response, side effects, hidden calories, and the body's weight defense create the gap. This gap can appear within either brand. The prescription name alone cannot predict the final result. Wegovy contains Semaglutide and works through GLP-1. Zepbound contains Tirzepatide and works through GLP-1 plus a second gut hormone pathway called GIP. Both can reduce hunger and increase fullness, but each person may respond differently. The 20% versus 5% gap is not simply a Wegovy versus Zepbound comparison. One person may stop thinking about food between meals. Another may feel only slightly fuller and still think about food all evening. The number on the pen matters, but it cannot predict the full response. To explain the gap, separate the drug's biological effect from everything that happens after appetite changes. A common misconception is that stronger nausea means stronger fat loss. Nausea may reduce eating for several days, but sickness is not the treatment goal. Some strong responders have little nausea. Some patients feel miserable, eat very little briefly, then regain normal intake after the symptoms settle. Wegovy and Zepbound use gradual dose escalation so the stomach and bowel can adjust. Starter doses mainly help the body adapt and may provide less appetite control than maintenance doses. Now compare two people using the same product. One reaches a maintenance dose, meaning a dose intended for ongoing treatment. That person takes every injection on schedule and notices smaller portions without constant effort. The other misses doses, pauses during shortages, and repeatedly restarts at lower levels. Their medication lists may show Wegovy or Zepbound for 12 months. Their bodies did not receive the same amount over time. Drug levels rise and fall with timing, dose, and interruptions. That difference can affect weight loss before food choices even enter the picture. Another reason patients may not receive a full, consistent dose is that side effects can limit how much they can tolerate. Persistent vomiting, diarrhea, constipation, or abdominal discomfort may block dose increases. Some people reduce protein, vegetables, and fluids because almost every meal feels unpleasant. The scale may drop quickly, but the plan becomes hard to continue. In contrast, a sustainable response often feels quieter. Hunger becomes manageable, portions shrink, and ordinary meals still work. The patient can hydrate, eat enough protein, and stay active. This pattern supports fat loss without depending on repeated sickness or severe restriction. That makes the actual Wegovy or Zepbound dose history more useful than the prescription name alone. One person maintains a steady dose and gets strong appetite control. Another has interrupted treatment or side effects that limit dosing. The drug may appear to fail before a stable dose has been tested long enough. Even with a steady dose, compensation happens when smaller meals are offset by calories elsewhere. A patient may drink sweet coffee, alcohol, juice, or high-calorie shakes. Liquid calories often create less fullness than solid food. Another patient chooses smaller protein-rich plates and removes most liquid calories. Both patients may honestly report eating less. Only one created a large enough calorie gap to keep losing weight. Wegovy and Zepbound can lower appetite, but neither counts calories or redesigns the food environment. Small additions can erase much of the advantage. The weekly eating pattern can widen that difference. Some people feel the strongest appetite control for several days after an injection. Hunger then returns before the next dose. If social meals or late-night eating occur during that weaker period, weekly intake can remain surprisingly high. Even when intake falls, the scale can hide progress. Salt, constipation, menstrual changes, and hard exercise can shift body water. A person may lose fat while weight appears unchanged for 2 weeks. Another may lose several pounds of water, then assume the medicine stopped working when water returns. Starting size changes the story further. Losing 20 pounds from 200 pounds equals 10% of body weight. Losing 20 pounds from 300 pounds equals about 7%. Comparing pounds alone can make two meaningful results look identical or make similar percentages look dramatically different. Health conditions also shape response. People with type 2 diabetes often lose less in weight loss trials than people without diabetes. Insulin and some medicines can promote weight gain. Pain can reduce movement, while poor sleep and sleep apnea can increase fatigue and hunger. Muscle changes can widen the difference. Rapid loss without enough protein or strength exercise may cause more muscle loss. A strong result combines steady loss as a percentage of starting weight with preserved strength and manageable eating. The fastest scale drop is not automatically the healthiest response. Beyond muscle, the body has another built-in defense as weight falls. A smaller body needs fewer calories to maintain itself. Hunger may increase as the body resists further loss. This is called metabolic adaptation. A dose that worked early may later produce a smaller weekly change. A plateau does not prove Wegovy or Zepbound stopped working. The earlier calorie gap may have narrowed. The patient may eat slightly more, move slightly less, or burn fewer calories at the lower weight. Together, these shifts can erase the gap. What matters is the pattern after enough time at a stable dose the patient can tolerate. Track weight loss as a percentage of starting weight, not only pounds. Compare the trend across several weeks, not one morning. Add waist size, hunger, meal size, side effects, missed doses, strength, and relevant blood tests. Early response is useful, but it is not the final verdict. Continued weight loss over several weeks shows that the drug and daily routine are creating a calorie gap. A flat trend requires investigation, not shame. Check dose history, injection timing, supply interruptions, liquid calories, grazing, sleep, and weight-promoting medicines. The next decision depends on what that review finds. Weak appetite control may improve with consistent dosing or careful escalation. Strong side effects may require slower escalation, a lower dose, or another treatment. Strong appetite control with no weight change often points toward extra calories, water shifts, or inaccurate tracking. Do not chase someone else's percentage by forcing a dose your body cannot tolerate. More medicine is not automatically better medicine. The useful dose produces meaningful benefit, manageable side effects, and a plan you can continue. Also, judge health improvement beyond the scale. A smaller waist can suggest less abdominal fat, better blood sugar, blood pressure, mobility, sleep, or liver tests may show benefit. However, those gains do not erase a weak weight loss result when losing weight is the treatment goal. With scale and health markers in mind, start the practical review with 3 comparisons. Compare your current weight with your own starting weight. Compare your current appetite with your appetite before treatment. Then compare your actual dosing and eating pattern with the plan you intended to follow. Wegovy and Zepbound can both produce major weight loss, but results vary widely. Look for consistent dosing, manageable side effects, meaningful appetite control, and continued loss as a percentage of starting weight. That combination shows whether treatment is working well, partly, or needs a careful change. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.